Hi guys. For my project, I decided to look at endogenous opioid dysregulation. So rather than looking at opiates as a drug, the natural receptors and proteins that we have in our own brains and as it relates to mental disorders. So the endogenous opioid system is a pain-relieving system within our bodies. This process is one of the ways that the body regulates pain, rewards, as well as addictive behaviors. And you may already be familiar with this because we've discussed endorphins and enkephalins, and they play a major role in this system. So endogenous opioid peptides are small molecules that are naturally produced in the central nervous system and in different glands throughout the body, such as the pituitary or the adrenals. And these peptides and receptors are significant because there's compounding evidence that those with mood disorders have dysregulated levels, notably in the beta endorphin levels, and they have a varied shape to their mu receptors. And as a result of this imbalance of the system dealing with addictive behaviors, there is an association of those who struggle with mental disorders and self-harming compulsive behaviors. And there's also a correlation between mental health disorders and cardiovascular morbidities. And this could be a lot of things. It could be an interplay of physical inactivity, poor diet, as well as substance abuse, but also genetic and the effects of any antipsychotics. And as we know, many of these can lead to drowsiness, dizziness, nausea, those kinds of things. So we as PTs have a responsibility to help those with self-harming behaviors. We need to be informed as to why people self-injure and develop a compassionate but firm approach to helping our patients to stop potentially harmful behavior, as it can greatly impact not only their mental health, but also their ability to progress through physical therapy. We need to do our best not to judge or criticize and approach mental health the same as physical health. You know, if it's hurt, help it. Self-damaging behaviors may have real impacts on physical therapy if someone, lacks the energy or motivation to do their exercises. Also, if they have self-inflicted injuries, we need to be aware both for our own practice, but also so we can refer them to other skilled professionals such as psychologists or other behavioral specialists. Of course, it's out of our scope of practice to diagnose mental disorders, but as providers who spend large amounts of time with our patients, we have an added responsibility to help those who may struggle with self-destructive behaviors, as we may be one of the first providers to recognize the signs and symptoms of various mental disorders. Additionally, it's important for the clinic. We need to simply know what different medications are, what they treat, what behaviors to expect, as well as the side effects of any medications. And, this may be easier in multidisciplinary settings, such as the hospital. Outside of those environments, it's helpful to coordinate care, and it really is an opportunity to offer better care for our clients. And we should always strive to do so by establishing better relationships with other providers. In this way, we need to be cognizant of the situations or thought patterns that may lead to vulnerable patients under emotional duress to have self-destructive behavior, which may interfere with their plan of care. In the short term, we can possibly gain more training and methods to soothe, and in the long term, we can work as a field to learn more about mental health and how best to identify various risk factors and sensitive personality types. So basically, just to reiterate, we have to have understanding of resources and establish good connections with other providers to help our patients achieve their best functional outcomes, both mentally and physically. Given that most people do not have information on the status of their endogenous opioid proteins and receptors, we as PTs could implement some sort of screening tools so that we can get a sense of who the vulnerable patients are and how to best proceed with therapy sensitively. As to whether or not this is in our scope of practice is a question that can be debated, but having a client do a quick 10 to 20 question questionnaire may have big impacts on treatment, and I personally think it would greatly improve our care. Like, for example, if we knew a patient had OCD, we wouldn't want to do anything to decrease that patient's sense of control or do anything without specified consent that may interfere with that person's sense of cleanliness. Like, maybe we wouldn't want to shake hands before we've had a chance to get to know our patients. Or with a patient with borderline personality disorder, it may be important to not bring up especially sensitive topics. Things that have to do with disagreements or rejections, real or perceived, can be triggering for them. So it could be beneficial for us as PTs to not mention specific topics that have to deal with, abandonment or fears of being alone with our patients that may suffer from BPD. But again, I just want to reiterate that there is increasing evidence that mood disorders come from biochemical imbalances, and we as skilled healthcare providers have a responsibility to treat all of our patients with respect, empathy, and we must listen for understanding as a way to improve our care. These are my references, and I appreciate you guys listening, and I hope you learned a little bit about endogenous opioid dysregulation and how it relates to mental disorders and PT. Thanks, guys.